actually a medical social worker out at Clarion West Medical Center. And I guess my story is more the concern I have in working with two different patient populations. The first is there are people that we can get enrolled in Medicaid. The problem is there are physicians, and a lot of physicians, that won't accept Medicaid. And when we're looking at this issue, I feel like we need to look at it both sides, where they can access the physicians, but the physicians need to be fairly reimbursed, because there are plenty of times the physicians actually can lose money on seeing people with Medicaid. My other concern right now is I'm working with a lot of people who are over 65 and have Medicare, and somehow, and they don't understand it, they have ended up on Medicare replacement policies. And there are a lot of these policies that actually are giving them benefits that are less than what Medicare pays for. And a quick example is if somebody fractures a hip, typically Medicare would pay for 20 days at 100%, and if they had their same supplement, they could have stayed in probably for about 3 months for rehab. At this point, I've actually run into Medicare replacement policies that don't even pay for rehab. So somebody who fractures a hip will probably never be able to walk again. So that's my story.
I had a growth in my face and in my neck. And my primary care physician once referred me to a specialist, ear, nose, and throat specialist, and they did a biopsy, didn't find any cancer, and they said, well, if it's not bothering you, don't worry about it. And so a few years went by, and I decided that I probably better have this thing looked at. The tumor was getting bigger in the side of my face, and over the course of time, the growth in my neck had gotten bigger as well. So I ran into a buddy at work that I hadn't seen in several months, and I asked him, well, what happened to you? And he said, well, I had a tumor in the side of my face, and I had to have it removed. And I said, well, you know, I've got a tumor in the side of my face, too. And so maybe I would go see your doctor. Well, I went to see his doctor, actually his surgeon, and they did another test and determined, yeah, you do have a parotid tumor, it needs to come out. I asked my surgeon how much this surgery is going to cost. He said anywhere between $40,000 and $50,000. That's a lot of money, but my insurance covered it. So I did go out there, had a successful outcome with that surgery, but as soon as I sat down in his chair, the surgeon said to me, now I know you've come out here to talk about this parotid tumor in the side of your face, and we're going to get to that, but what have you done about that growth in your neck? Why has it been allowed to get this big? And so I told him, well, you know, I've been to my primary care provider, and I went to see the ENT, and they all told me if it's not bothering you, don't worry about it. And so he said, well, it's gotten bigger than what it ever should have been allowed to get. And as soon as I got back home, laying down and resting on a Thursday, the surgeon from LA called me and he said, Hetty, it looks like the preliminary pathology report says that growth was cancer. The entire 2 inches that I took out of your neck was cancer. 3 days later, I'm on an airplane back out to Los Angeles to have the left lobe of my cancerous thyroid taken out. Now, I had a choice because I have an employer who provided me with excellent health care coverage. And, you know, I got quality health care after I went to LA. I should have been able to get that same quality health care in Indiana, but I didn't. And by the way, the surgeon also has a charitable foundation, and he underwrote the cost of me flying back out for the emergency surgery, provided for my hotel stay, which was a 4 or 5 night day hotel stay. In addition to that, because I had to go out there by myself in an emergency, he also underwrote the cost of having a day nurse stay with me overnight. That's quality health care.